From eastern Uganda to Nairobi, Kenya, Dr. Monique Wasuna's story is one of following your heart and what you are most passionate about. It is about strong family support that pushes and elevates you as a woman to realize your full potential.
I'm Dr. Monique Wasuna. I'm the director of the DNDi Africa Regional Office here in Nairobi. I am in charge of at least about 38 members of staff, ensuring that they work well and they participate in our research activities. But we, as you know, DNDi is a not-for-profit drug and development organization. And we trying to find treatments for patients that are suffering from neglected diseases. And so our task on a daily basis, whatever we do, is to find treatment for these patients. And we are working in the area of visceral leishmaniasis. The terms are hard, so I can shorten them, or Kalaza, and also mycetoma. And we also have other areas where, there's neglect, like in pediatric HIV, where children don't have palatable treatments. That what they have is bitter, it's got alcohol, and so we are trying to find alternative formulations for children. I'm born Ugandan. My father is a Ugandan, comes from the eastern part of Uganda, Teso. And my mother is from Rwanda. And of course now my husband is Kenyan, so I'm an East African. Yeah. So I grew up, I was born in Soroti, in Teso. And I grew up in Uganda, obviously. And I went to schools there. I went to high school, I went to Rural Girls High School. And then from there, I came to University of Nairobi. Rural Girls was a very fine school, yeah. It was a posh, nice school, and they offered science. There was science stream, there was home economics, there was, like accounting streams. So I was in the science stream. So, like the stream I knew, from that age, science, because I loved maths and I loved biology and chemistry, so they put you in that stream. So really, you're now programmed to do science. But I wanted to be an airline crew. That's what they call it these days, but those days was air hostess. And I just wanted, so every essay that I wrote, I was imagining being in a plane and, being an airline crew and helping people in there. And it would read so well that I would get, very good comments from the teachers, straight A's. My father, is somebody who loved education, and he made sure he treated us equally, the boys and the girls, and made sure that he treated, we all went to school, and he ensured that particularly the girls went to school, because we were growing at an era where, girls were supposed to stay at home, work around the house, but my father, we were the same. And on a weekly basis, roles would change. Today the boys are sweeping the compound and the girls are cooking, and the following week the boys are cooking, the girls are doing the job that the boys were doing. And so even today my brothers are one of the best cooks. So my father just made us, I didn't grow up feeling like I'm a girl. I grew up feeling I am, person, a human being, an equal person to the boys, so we didn't feel demeaned or anything. When I was, I think, in Form 6, one of my younger sisters got measles. Despite vaccination, she got measles. And she was admitted in hospital, and my mother was looking after her, and I went to see them in hospital. And she was really, really, really sick. Now looking back with the medical knowledge that I had, I think she probably had bronchopneumonia, and she was, because she was on this drip and, breathing heavily. So she she was very, very ill. And my mother was just looking so distraught. And each time I went, the same situation, and the doctors had told my mother not to pin hopes on this child, probably will die. And so the look on my mother's face, you know, when she looked so helpless. And I said to myself, I never ever want to see this look on my mother again. And thankfully my sister lived. And I just decided, this is it for me. I must be one of the people who are taking care of these helpless people. When we were in Form 6, so we applied. You know, you apply to go to Makerere, or during those days, you know, they had this East African cooperation. So if you wanted to do medicine, you'd go to Makerere. And then if you want to do engineering, you'd go to University of Nairobi. And if you want to do law, you go to Dar es Salaam. So those were the schools. So naturally, from my sister, you know, from that feeling, I wanted to do medicine, so I'd apply to go to Makerere. And so we wait for the results, and when the admission form came, they said Monique Geelong, then not Wasuna, Geelong, you know, been admitted to University of Nairobi Medical School. And I'm like, what? I never applied. And at that time, I think the medical school in Nairobi was new. And so the government of Uganda wanted to send some students to test waters. How good is this school, medical school? So we were like guinea pigs. We were 10, 2 girls and 8 boys. When I finished, I did my internship at Kenyatta National Hospital. And I worked under very many people, Professor Mati and in Obs and Gynae. I worked with Dr. Philip Ruiz, late, God rest his soul, because he just taught me a lot of medicine. And I worked for Professor Wori. I was his intern, and I loved him to death because Professor Wori would like, you've been here since when? I say, Prof, Monday, Tuesday, but go and sleep, yeah? Because, you know, you have the farms in Kenyatta, you rotate, you do every 3 nights, then you go off to another farm. So I was in Professor Wori's farm, and he always looked out for my welfare. Yeah, so I did internship in Kenyatta, and after that I did my medical officer's job, still at Kenyatta, at the filter clinic. I was the deputy in charge of the outpatient clinic in Kenyatta. And then KEMRI was being set up at that time. It was, and I was working with Dr. Koech was working just across in the public health labs, and it's like, you don't want to come and do research with us? And I'm like, sure. I have an investigative mind, and I like to. There are a few things that I want to find out, you know, because research is just about answering some questions, and yeah. So then they advertised the positions in KEMRI. They're looking for doctors, and as I joined, KEMRI was getting an institutional strengthening grant from WHO. World Health Organization. And so they were, and plus other funders. So they were able to say, okay, this year we want to train people in this area, in this area, in this area. So it was programmed. So when I joined, they're like, in 2 years, you can't train, but we will send you to train. What are you interested in? So we discussed. So I knew exactly, come this year, I'm going for training. So I went and made my second baby. And then after that, it was qualified for training because it was so programmed. And I was sponsored by the World Health Organization, TDR, to do a master's and then also a PhD at the London School of Hygiene and Tropical Medicine. What happened is that my husband is also a medical doctor. He's a professor of neonatal medicine at the University of Nairobi. So then he was a registrar at the Kenyatta, the University of Nairobi, yeah? Senior lecturer, University of Nairobi. And so he also got a scholarship to go to London. So we went, and we had 2 children. And he was doing his neonatal medicine at the Hammersmith, and I was at the London School doing my master's. There was never such, it was the most difficult part of my life. Because as you know, Europe is not like here where, you have a house help, you have a gardener, you have a watchman. That's not the life. The life there, you have to have money to have that kind of life. We're just students. He also had a WHO grant, and I had, so you put the 2 grants together. But you know, if you're determined to get to where you want to be, there's nothing that can stop you. This postgraduate training usually opens somebody's eyes. You open and you see what is there. But even before that, I had an experience at Cambridge, and we didn't have the 40-bed ward facility that Cambridge has now. We were working from IDH. And so I was living in Kenyatta, so every morning we would walk across the road and go to, we call them IDH those days, but it is Bagathi Hospital. And of course, being a junior doctor, you know how it is. You have to be the first one there in the round. And you have to know your patients, you have to clerk them. And so that's where we started admitting the Kalaza patients. And so because we are just new, you're walking, taking notes, you're being asked questions. But I could see the knowledge that these people had, and the passion to teach the younger generation. And I grew to be interested in this clinical research, because I had never even heard of clinical research, so what does it mean? So I learned that, you have to be meticulous. In clinical research, you have to be meticulous. And even the way you write your notes have to be clear. If you cross it, you have to sign it and date it. I learned a lot of things, even just how to give medicine. And a trial, you just don't give at 1, at 2, at 3. It has to be at 9, at 9, at 9, how to collect some. So that, system is built in you. So I had a patient who was very sick with leishmaniasis. Actually, we tried everything. And as a doctor, sometimes you get attached to the patients. So this was like 10, 12 years old patient. I got attached to this patient because whatever was being done to him, he was not responding. And so I kept going to the ward to look at him, to find out if I could do more. And then the nurse is like, we need to transfer this patient. He's not doing well. But they said, we don't have a car. And I'm like, I will take him. He can't die here, I will take him. So I literally drove this patient in my car and went with him to Kenyatta. And as we are taking him out of the car and really running to casualty with him, he died in my arms. And I'm like, whatever this disease is, you have a doctor that is going to work in this area. So that's why I got into leishmaniasis. In 2003, 2001, 2, I got letters from MSF. And MSF wanted me to go MSF had just won a Nobel Peace Prize, and they were having this idea of creating an organization that would try to find treatments for neglected patients. And so I don't know who gave them my name, but they wrote and said, there's a big meeting in New York. Please join us. We are going to discuss the creation of this institution. A mother of 2. And, you can't just, and it was 3 days to the meeting. And I can't uproot myself to go to New York in 3 days. But you know how those days were proactive. I even had a visa. I had my visa for 5 years. I was having it all the time in case one day I get an opportunity to go to America. The opportunity came, and I couldn't go because my children, I said, my children come first. Yeah, I can't go looking for something and when my family, so I needed to find, sort them out. My husband is busy. So I just looked for one of my colleagues. She's called Jane, Dr. Jane Mbui. And I know that, when you instruct Jane, Jane will follow to the letter. So I called her, I said, Jane, do you have a US visa? She said, yes, and I have nowhere to go. I have been having this visa. I said, okay, how about going to New York? She jumped up and down, up and down. And I said, you see, go there and make sure you don't go to the shops. Make sure that you're in these meetings, because I need to know what's happening here, what's going on. And Jen truly went to that meeting, and she went through all the sessions, and then she came and briefed me. And she told me how they want to create an organization, so they're trying to find partners in Africa. So I said, okay. So then again, they invited me after some time to another meeting now in Paris. And that time there were 2 weeks in notice. So I said, okay, this time I'm going. And I went. And, you know, I think sometimes us in Africa, we let opportunities go, yeah? And we want it for ourselves, and we don't want to let someone else have it. If I had not given Jane that opportunity to go, to be in this meeting, come and brief me, I wouldn't even taken this other meeting seriously, yeah? I would say, you know, watch I cry. So they wrote, and I said, I am going. And I went, and they invited almost 30 African countries. But do you know how many came? 4. It was Kenya, me, Sudan, South Africa, and Morocco. So they decided we just discuss with you people who have come. And so they got us a moderator from Zambia, Professor Ali Zumla. He's also UCL, he works in UCL in London. So we discussed, they brought everything. I think they wanted to have a meeting in Africa, and they were looking for someone who could host this meeting. So for me, being a Kemri scientist now, I know that you always have to be a step ahead, yeah? Always be ready, be a step ahead of the pack, and that's how you get to the top. And so I started to make a brief note because I knew where this was leading. They were looking for an institution, so I started to write about Kemri, all the good things, the points. So the people gave, and I made sure I was the last one. So I talked about Kemri and about what we are doing and the capacity and the premier institution, everything positive. And everybody, so when they said, who is going to, they said, but Monique, she sounds like they're organized, they're ready. And so we held a very big meeting in 2003, before DNDi was created. The MSF and other DND, Drugs for Neglected Diseases, a working group. And we brainstormed, you know, like, what is neglected diseases in Africa? They are neglected, we have very many groups. It was an excellent meeting, and at that meeting they said we are looking for an institution to be one of the founding partners. And of course I briefed my boss, Koech, and you know Dr. Koech very well, also, you know, alert to the situation. So when it came to the debate, they just said, Kemri, when you put your trust in God, yeah, and ask God to help you, and tell him this is the situation, like, all these neglected patients, yeah? I always count my blessings, and I feel I'm so blessed, yeah? Such that I will do even work that I'm not supposed to be doing, but it drives me, the neglect drives me, yeah? If I can do something that will alleviate this suffering, so if I can participate in this clinical research, to be able to bring treatments for these patients who are neglected, I would have done something for mankind. So it's that neglect that drives me. I wake up in the morning and I really, really don't regret, because these are people that are growing up in abject poverty, yeah? They have at least one neglected tropical disease, but maybe even 2, 3, yeah? And it's not a fault of their own, it's just that the systems, the structure, you know, there's no clean water, you go in the river or wherever and you get sick, or you don't wash your eyes, you know, or you know, sleep without a net, you know, you get bitten, you go on top of us, you know, a hill, and you get all these illnesses. So if I can be the voice of change, if I can do something, and if I can talk to the politicians, if I can get into these big conferences and stand where, you know, men are standing, but I'm a woman, and I am a scientist, I am a doctor, I am, you know, I'm fighting for these people that have been left marginalized, stigmatized, traumatized, you know, we're having no voice. You look at them and you really wonder whether it is fair that this should be happening, yeah? So that's what drives me, and I have no regret in being in this space. For me, as Monique, I am I am so happy that I came to medical school here, married this gorgeous man, and I have lovely children, 3 of them. I have 2 doctors and 1 lawyer, and really a proud mom. Everybody's gone to school. Some of them have done their postgraduate. And so that is a fulfillment, yeah? I feel we did it right with my husband. We managed, because it's also a full-time job, but also then achievement of a woman in science, yeah? Being now a woman that people look up to, and in science consult, asked to speak, even where, you know, presidents are, or, you know, like I didn't tell you, I was one of those who went to Macron. I was one of those who asked Macron a question. So I find that, you know, you are cited as one person that makes a difference and who can inspire. But I feel I haven't gotten there, because the aim is to mentor young scientists, young women, yeah, especially women, to take the mantle and, you know, to run with it and just make them feel confident. You know, if you're not confident, if you don't believe in yourself, if you don't dream and have goals, you are going nowhere. You have to have a vision, you have to have a plan, and you have to be determined, you have to have passion, and you have to hold the hand. Like, I'm stretching my hand to hold another woman. Don't look at a position and say, I can't do it. The minute you say, I can't, you're telling your brain you can't, the brain tells you you can't. So anytime you try, the brain reminds you you can't. So what we tell our brains is important. Yeah, so must always be positive. And hold each other and propel people to success. And I also want to talk to the youth, and I say the future belongs to you, to the youth. And don't be an age group that will disappear. Yeah, we are now getting old. We need you to come up. Yeah, so a concerted effort has to be made to bring in young people into organizations like this. And I have young people here. If I move today, there are 3 or 4 people who can take my job. So, you know, that's how it should be. We should mold and prepare the youth for leadership.